We are recording. Hello, everybody. Welcome to our episode 2 of the I Can't Breathe series, where we will be interviewing multiple people who have been struggling with pericarditis or recurrent pericarditis about their journey, their story, and lots of other questions. We got quite a few people who submitted a written Q&A with answers to the questions because they wanted to remain anonymous. So I will be posting new episodes with their answers next week. Today, however, I'll be answering the questions myself and sharing my story and my journey with pericarditis. And yeah, before we get started, I would like to point out if there is any questions that you would like to ask, or any topics that you'd like to see an episode about, be it maybe like anti-inflammatory diet or supplements that have helped with inflammation, or whatever other topics you would like to see episodes about, please leave them in the comments so we can see them and make videos about them. And we also have a Discord group, a pericarditis support group that you can join, and there's people there that are wonderful, and they've been struggling with this for either months or even years, and it's a beautiful, super supportive community where you can reach out and talk to people and all that good stuff. So yeah, that being said, without further ado, I guess I'll get started answering the questions that Chris answered last week. First question: when was my first pericarditis episode? It was December 2022. It's going to be 2 years this December of me having this disease. And my first symptoms were, I guess, a little bit of background of what my life looked like during the time that I got the disease. I was working very hard. I used to be a nurse at a cardiopulmonary critical care unit. I used to take care of lung transplant patients, people who had minor heart surgeries. And I worked 12-hour shifts, and I wasn't really nourishing my body. I was working out strenuously after work, and I was really pushing myself. I wasn't sleeping well, which I think was a big factor that contributed to this, is that I was sleeping an average of 3.5 hours a night, sometimes 4 hours. And one day I was working out at the gym. I used to lift, and I was working out after work, and I was just doing my usual routine. I wasn't really overdoing anything. It was just maintenance workout, and I was lifting weights, and I felt extremely short of breath out of the blue. I felt very dizzy. My heart started racing, and I couldn't breathe at all. I had to put the weights down and sit down and lean kind of like over the floor. Like I was on the floor on all fours and just trying to take deep breaths because I couldn't breathe. And I remember I took my phone and I was about to call 911. It really scared me. I felt a lot of chest pressure and just dizzy. And I ended up being able to take a full breath, so I didn't call 911. But that was the first red flag that I should have paid attention to, because that was a couple of days before I had to go to the ER. So this happened on a Monday, and I went back to my apartment, and I guess I didn't think much of it, but during the night, during the next couple of days, I started feeling like this weird chest pressure, and I had been overworking and just really anxious. So I thought the chest pressure was just me being anxious. But then it increasingly got worse and worse the following couple of days until Wednesday. I went to bed, and it was really uncomfortable because I felt this tremendous chest pressure and I didn't know what was causing it. I lied down, and the pain got worse and worse, and I felt like I had this animal sitting on my chest, like really heavy. I couldn't take full breaths lying down, so I had to sit and sort of lean forward to take deep breaths. And I guess around 1 a.m., after a couple hours of trying to sleep, it got increasingly worse. I could not take a full breath at all, and that's when I got scared. that's when I thought to myself, okay, I can't breathe. I can't breathe at all. And I knew something was very wrong. I had work the next day, so I was contemplating whether or not I should go to the ER, but I decided that I had to because this was not normal. So at first I thought I was having a heart attack because of the chest pain and the shortness of breath. So I drove myself to the ER, and I remember walking towards my parking lot where my car was. It was a struggle to walk through the hallway towards my parking lot. That's how bad it was. Like I could not breathe at all. So I got in my car with a lot of trouble breathing, and I drove myself to the nearest ER, and I told them, hey, something feels wrong. I can't breathe. I have a lot of chest pressure, chest pain. And they looked at me and they sat me down. And by then, by the time I got to the ER, I was like gasping for air. I was fully gasping for air. I could not take a full breath. It was horrible. And the people who saw me, they looked at me and they told me to wait in the waiting room, which, first of all, they should have taken me in as priority because of the chest pain, but they didn't do that. They just told me to sit down and wait, and then somebody was going to come take my vitals. And then this male nurse came and he was taking my blood pressure. And that's when they decided to take me in because they saw, like, oh my God, this person is like gasping for air. And they took an EKG, and I saw that there was something wrong, and I didn't say anything to them. I was just like, what's happening? They put an IV on me, and suddenly there was 4 people in the room as I was gasping for air, and they weren't really telling me anything, but I saw a lot of people, and that's when I know, okay, well, this is odd. So a second doctor came in, and he wasn't a very pleasant person. He just looked at me and he just said, oh, you're having a panic attack. You need to calm down. He convinced me that I was having a panic attack and that I needed to go home. And then he referred me to a psychiatrist and a cardiologist. And I knew it wasn't a panic attack because I had never in my life experienced anything like this. So the next day, I went to work without being able to fully breathe. My coworkers were looking at me. They were like, what's wrong? Something is wrong. What's going on? So my manager came up to me and she took a look at me and she was like, you need to go to the ER right now. You're clearly short of breath. And I told her, yeah, I feel chest pressure. I feel this and this. And she was like, you need to go to the ER right now. There's something wrong with you. And I told her I just came back from the ER. I had just been to the ER that same night, and they told me I had a panic attack. And she said, I don't care. You need to go to a different ER then. So I left work to go to the ER. But I knew that I knew they weren't going to do anything besides refer me to cardiology. So what I did was I looked at a cardiologist in the area, and I found an appointment for as soon as possible. So the next day, and I drove myself all the way to this cardiologist, and he took a look at me and he said, there's something wrong. Your EKG is not normal, but I don't know what you have. So we'll run some tests. I booked an MRI and an echo for you for March. And this was December. And I was like, I can't wait for March. I can't breathe. And he said, well, I just don't know what to tell you because I don't know what you have. I can't diagnose you. We're fully booked right now, so you have to wait until March. So I left, and I realized my options were I either go to a different ER or I find a different cardiologist. So I had a second cardiologist that was on my list, and he was available the next day. And so I booked an appointment with him the next day. And I really struggled that night. I didn't sleep at all because I could not breathe. And I walked into his office. He took a look at me and he said, I know what you have. And I told him the other doctor didn't know what I have. And this other person told me I have panic attacks. And he said, no, I know what you have. You have acute pericarditis. And he explained to me what he saw. He took an echo right there. He explained to me what he has seen. And he said, here's what we're going to do. I'm going to put you on this medication called colchicine. And I'm going to put you on a lot of aspirin. and then we're going to see how you react and how you respond to it. And if it gets better after you take the colchicine and the aspirin, then it means that it's pericarditis. And I was like, okay, I'll take it. So I took the colchicine that he gave me, 0.6 milligrams twice a day, and with the aspirin. And it was like the highest recommended dose. So I was a little bit reluctant to take it because I mean, I had never seen that high of a dose given to people. I took it, and immediately 30 to 40 minutes after taking it, I could take a full breath. And so it turned out that it was, in fact, pericarditis. And he said, you need to be on complete bed rest. So I called my work and I told my manager, this is what I have. And she said, oh my God, that is horrible. Please take as long as you need. And they gave me 3 weeks off to recover. And the initial plan was I would rest for 3 weeks and then we would check in and see if I could go back to work. Needless to say, 3 weeks later, I was still not recovered. It would take me actually 6 months to be able to to be able to even breathe well, sort of. So, yeah, I ended up needing 6 months to recover from this first initial episode. But yeah, the cardiologist that diagnosed me was an angel. I got very lucky, although I did have to see a couple of doctors before him. I knew in my heart that there was something off, there was something wrong, and that I needed answers immediately. And I can only imagine if I had listened to the first ER doctor or waited until March, maybe I would have wound up being hospitalized. Maybe I would have gone back to work and been on my feet for 12 hours doing strenuous, very stressful work, and who knows what would have happened. I'm grateful that I didn't accept their answers. So that was my diagnosis. As far as testing that they did, I got a chest x-ray, I got an EKG, I got an echo, I got the blood work for inflammation markers. They looked at my troponin levels. They were like, okay, you don't have an MI. And then later on, other cardiologists did look at my inflammation markers, my CRP, and it was very, very high. And I've had a couple other bad experiences with other doctors, other providers that have misdiagnosed me or that have been unable to look at the red flags in my results. But I guess I'll get into that later. My initial treatment was 0.6 milligrams of colchicine twice a day. And I think it was 650 milligrams of aspirin every 4 hours. So I would set alarms on my phone for 4-hour intervals, and I would take 2 tablets of 325 milligrams of aspirin. And I did that for a very long time. I didn't think of taking omeprazole that early, but yeah, right now what I do is I take it with omeprazole, which is a proton pump inhibitor, and it helps protect the stomach against the aspirin. But yeah, that was my initial treatment. It lasted for 3 months, and 3 months after that, I had moved back home because I ended up quitting my job because I was unable to go back to work because I was not able to breathe. So I had to quit my job. I had to move back home. And then I found another cardiologist back home, and he looked at my CRP and he was like, oh no, you're fine. Like nothing's wrong with you. Like you just have anxiety. And then my blood work came back, and then they called me from his office and they were like, hey, you have extremely alarming inflammation markers. There's a lot of inflammation in your body and it's extremely alarming. And I was like, no way. Anyway, but yeah, basically what he did is that he continued to just send me refills for colchicine. I've been on colchicine ever since, on and off. Like I was on colchicine for 6 months initially, and then I tapered it. I got the green light to taper it during that summer. And I was able to only be taking aspirin during flare-ups without the colchicine for 6 months. And then I had another really bad flare-up because I got COVID and I ended up in the ER again, and they put me on colchicine again. On the daily, when I am free of a flare-up, I don't really, I try to keep my exercise low. I don't overexert my body. I don't lift heavy things. I only walk the necessary amounts, and I try to work from home as much as I can. Sometimes I do get chest pain when I go up an incline or try to go on a mild hike. So I don't do that very often unless I know that my body can handle it. And then sometimes if I do say go on a very small hike, I'll get inflammation that night, and then I'll just have to take aspirin. Um, but yeah, during a flare-up, however, that changes. And the way that I know that I'm getting a flare-up is because I'll wake up in the morning and I'll feel extremely fatigued and extremely tired. And that's how I know that something's gonna happen. And then sometimes I wake up and I have chest pain out of the blue, and it's just this discomfort. It's almost chest irritation rather than a sharp pain for me. It's more like a dull, constant pain. And then it gets progressively worse, and usually around 7 p.m. without fail, I'll start getting inflammation. And that's how I know that a flare-up just started, is that around 7 p.m. I'll start feeling more short of breath, and then it gets progressively like worse throughout the night. My stomach gets a lot of inflammation and it bulges out where my diaphragm is. So it bulges out. My abdomen feels inflamed. It feels warm to the touch. And then I just feel shortness of breath. And it's interesting because it starts around 7 p.m. It gets progressively worse, and then it peaks around 1 a.m. And around 3 a.m. it starts getting better. I usually, what I'll do is like I'll take the colchicine at 7 p.m. and then I'll wait until 8. And then at 8, I take 325 milligram aspirins. And then 4 hours later at 12, I take another 2 aspirins. And then that usually gets me through the night. But yeah, that sucks. So yeah, that's what I feel during a flare up. And then that's the first day. The second day, I usually feel inflammation throughout the day. The third day, feel inflammation throughout the day, gets worse at night. And then it's usually over 3 to 7 days after. Depends how long it lingers for. But I've had flares that last 1 day with very little irritation, pain, and inflammation, and then flares that last a couple months. Depends. How many ER visits have I had? Maybe like 5 ER visits. I was thinking about flares. Flare-ups, I've had more than 8 or 9 for sure. And ER visits, I think I've had 6. So I had the initial one, then I had another one, then I had another one, and I got hospitalized for 1 night. And yeah, it didn't really help me. They had no answers to give me. It gets better once, like after the first one where he told me I had a panic attack. I'll just tell them, like, hey, I have this disease. This is what I'm struggling with. What they usually do is they run these tests to make sure that there's no complications, no pericardial effusion. And then they just like do that. So yeah, ever since the first, like it's gotten better because now I have a diagnosis. So they sort of like know what to look for instead of just telling me that I have a panic attack. Yeah. So what's my treatment for the foreseeable future? So there's nothing planned. My most recent cardiologist, he looked at me and he gave me colchicine prescription. He just sends a prescription every month for the next year. And so I'm going to be on colchicine for the next year. And then he tried to get me an MRI with contrast to look at the amount of damage or inflammation, or I guess figure out exactly where the inflammation was. So you need an MRI with contrast for that. And I didn't do it because I moved to a different city. But yeah, he just told me that if I'm doing well with just colchicine and aspirin, that he doesn't want to put me on Arcalyst because ARCALYST is reserved for more aggressive cases. So that's what he said. And I haven't seen him since January of this year. Let's see, what symptoms would I look out for before deciding to go to the ER? I usually monitor my heart rate and make sure that I don't go tachycardic, say above 180, like a resting heartache of above 150 or 180, dizziness, severe shortness of breath, I would say, worse than usual, because I have experienced shortness of breath throughout the night. So I make sure that I can always take at least one full breath. And I would look out for dizziness, high temperature, feeling really sluggish, and pain that doesn't go away with the aspirin. That's what I would look out for. And yeah, I wouldn't usually go like, yeah, I guess it wouldn't be something that I consider very easily. What does a day in my life look like in the present? I try to keep I try to keep physical exertion to the minimum. I go on walks, I work, I try to rest in between work days when I can. I try to not overexert myself. I eat as clean as I can. I'm vegetarian, so I eat very, very clean. I drink detox juices every morning, especially now that it's cold season. Yeah, it's pretty calm. I try not to overexert myself. And what did my life look like before pericarditis? Very busy, very, very busy. I worked 12-hour shifts. I was not following a good diet and I was not sleeping very well. So at least now I get to sleep, thank goodness, except when I can't breathe. Then I don't really sleep. But yeah. Anyway, I used to work out 5 days a week for 2 hours a day. I used to lift very heavy and I loved working out so much. It was my mindfulness practice. Whenever I would feel stressed or angry or sad, I would work out and I would feel amazing. And it's one of the things that I miss the most is being able to go on a run or just being able to go on a hike with friends or just being able to do a simple workout. I miss that a lot. Before pericarditis, actually, I had a lot of anxiety. I was coping. I wasn't aware that I was depressed, but I was very stressed. I was under a lot of pressure and I was feeling just not healthy emotionally. And after pericarditis, I surprisingly enough, I don't know, I think I've been able to build some resilience and I'm very grateful for everything in my life after this. I think there was a lot before that I didn't notice or that I didn't appreciate, that I wasn't aware that was there, like my physical well-being and my health and my ability to do things and go places. Being able to just travel by plane is something that, because of this disease, I haven't been able to do yet. Yeah, so I took for granted a lot of things, and now I value what I have a lot more. So I value the good days. I value the days where I'm able to go on a walk in the sunlight and touch some grass. This disease has taught me a lot. It's taught me a lot about managing how I feel, and it's helped me become more compassionate towards others because I was very young when I got sick. I didn't really know what it felt like to be bedridden. And now I can empathize and I can feel for people who are suffering a lot more deeply. And that's something that I'm very grateful for. In a way, I'm grateful for this disease because it's helping me become a better person. I guess I was a good person before, but it's helping me become better in ways that were blind spots for me before. And I know that if one day I am ever able to work out again or lift again, I will appreciate it so much more. I did have a history of general anxiety, social anxiety, a lot of stress, emotional trauma. So that I did have a history with. My most felt emotion on average presently is probably gratitude. Gratitude for the small things like just sunlight coming through my window or just fresh breeze and nature, being able to go for a walk or the ocean. Just gratitude, just very grateful to be able to feel all of these things. Do you have a mindfulness or meditation practice? Yes, I do. I practice meditation every single day, and it's helped me tremendously. I do various meditation practices. I chant mantras and I do breathing exercises. It's made a huge difference. I don't know where I would be without these practices. It's helped me more than any conventional treatment I've gotten from Western medicine. So, meditation practices have healed me in ways that doctors haven't. That's just my experience with that. Have you tried any forms of alternative or holistic medicine? Yes, I have. I've tried traditional Chinese medicine. I got some wonderful herbs that helped me taper off colchicine and stop colchicine for 6 months before I got another flare up because of getting sick. So that was great. I tried energy healing. I tried pranic healing. And I currently get pranic healing, which is a form of energy healing, every time I have a flare up or every time I start to feel a little sick. I get healing pretty consistently, and it makes me feel better and it makes my body feel very energized, and it just helps me recover a lot faster, I've noticed. And if I could give a word of advice for people who have been diagnosed with pericarditis, what would it be? It would be trust your body. A lot of people have said this before, but just trust your body, advocate for yourself. If you feel pain, the pain is real. If you feel like you can't breathe walking up a flight of stairs, or you can't breathe going up a mild incline, or you can't breathe when you're sitting down or lying down, that's not normal. Trust your body. And yeah, doctors are also learning about this as we are. Look for different sources of comfort. Energy healing and meditation have been incredible for me. I can't stress that enough. So yeah, I would say picking up a small meditation practice, some breathing exercises, clean diet. Diet is so important with this because diet can contribute to inflammation in the body, and our cells use what we eat to regenerate and to form tissue. So if what we're eating is not good, is not healthy, is toxic, then that's the material that will be available for the cells to regenerate. So it's important to have clean material, healthy, fresh produce, so that our cells have material to work with to build new tissue. And so diet is very important for me, and drinking lots of water. Something that was mentioned briefly on the last episode is watch your thoughts and your emotions. I've noticed that anger plays a big role. Whenever I get really angry, I'll have a flare up immediately the same night. It's wild. I've actually kept like a little list of all the times this has happened. And without fail, if I have a big emotional outburst, I'll get a flare up. And so emotions and thoughts really contribute to this. And that's why I feel like mindfulness and meditation are practices that are important, because they help shift our internal world. And that internal shift impacts the external. And so as we shift internally, the external follows. And I've noticed that cultivating gratitude, forgiveness, and things like that really does impact the state of my body tremendously. So yeah, that's what I would say. And I guess it's been a while since I've been talking. So if you've made it this far, if you've made it all the way to the end, thank you so much for listening. I hope that this was helpful. We will be posting every week episodes. So if you want to be interviewed, if you're struggling with pericarditis and you want to share your story, please comment or reach out through the Discord, send me a DM, and we'll do a phone interview completely anonymous. If you have any questions or any topic that you would like to hear about, please also feel free to comment and give suggestions so we can talk about it on the next podcast. I hope that you're taking care of yourself, that you're advocating for yourself, that you are healthy, that this disease will leave your body and you will fully recover completely and you will get healed.